donating blood over 15 years now, and I'm up to over 4 total gallons, which is over 34 pints. I started donating when my youngest daughter needed surgery a long time ago. Luckily, they didn't need my blood for her, but it brought up something in my blood that led me to be motivated to donate for other reasons. After I donated for my daughter, a few years later, the blood bank called me and said, "Mr. Chapman, we really need your blood. We have an infant who needs your blood. Can you please come in?" I was confused. I had no idea why they needed my blood. So I went down, they expedited my blood donation and told me I was CMV negative. I asked them what that meant, and they said I had not been exposed to a certain virus, so I didn't have antibodies that most people have, that if transferred into an infant or somebody with an immune compromised system can cause a lot of harm. So that what they need for babies is CMV negative blood. And there was actually an infant waiting for my blood. So when I left that day, I was thinking, I just saved a life. Well, the donations I had made in the past, I didn't know there was anything special about my blood. Blood basically is taken and divided into 3 components: plasma, platelets, and red blood cells, which are used in different ways for different reasons. Some of them aren't necessarily life-saving, but they help tremendously with people like cancer patients and other folks with certain diseases or problems. With mine, if there's an emergency situation and they want to transfuse a blood component or whole blood into somebody who is at risk, it helps tremendously to have this negativity, this lack of antibodies. That's why I kept donating. So my blood is kind of valuable, I guess. You know, now that I know about it, I feel it's a moral obligation I have. Makes me feel pretty special. Speaking of special, they call this kind of blood, the CMV negative, baby's blood. And I kind of like that term. Glad to help.